It is where the samples might not be, or the specimens may not be adequate for laboratory investigators to determine sort of abnormality from normality in context of what is in context of what frontline practitioners practitioners are questioning in context of or suspect in around what suspect in around patient or patient cases. So it is very easy for particular specimens or samples that they can be more liable for this well, they can be more liable in around distortion in aspects of distortion, and there is some there is some literature in around this, and there will be some literature cited or referenced and as part of this particular this audio podcast series. Additionally, as part of this audio podcast. So then there is the sort of clearing stage, and this is where xylene is utilized to remove alcoholic dehydrating agents from the specimen, preparing them or prepping them for paraffin wax, fixing during and leading into the embedding stage. The basis of xylene, the basis of xylene, additionally, is to actually remove any debris, in around particular aspects of the previous two sort of preparation stages, being the chemical fixation and coagulation or dehydration sort of stages. So then going into the embedding stage in context of specimen preparation as part of as part of the patient case, and looking at a suspect diagnoses of tuberculosis from a patient case from a specimen of pulmonary lobectomy. From the pulmonary lobectomy sample or specimen, there is then the embedding stage, which is where specimens are encased in paraffin wax. The idea of a paraffin wax, listeners and viewers, is actually to see that specimens or samples actually have a sort of a basis of where under microscopy investigators are able to fixate on what are primarily the abnormality elements of the pathogenesis of the specimen. So the specimens are encased in paraffin wax blocks and sort of structures, and this additionally sort of enables enhanced preservation. So again, to say to inform to inform on this, where under microscopy in under histopathology laboratory environments is where investigators can determine the abnormality element of the specimen. So enables enhanced preservation and also a sort of visualization of the tissue specimen. Then there is the sectioning basis, which is where blocks are then sectioned using a microtome. Microtome is basically a small sort of blade, a small blade that is used to actually section out section out a specimen, section out sort of a specimen once a sample has been prepared. So blocks are then sectioned using a microtome, which then sort of slices the specimen blocks into 4 to 5 micrometer slices, approximately 1 cell thick. These slices are then free floated in a warm water bath and mounted onto glass slides, ready to then be initially ready then to be initially stained through hematoxylin and eosin. And then H&E staining, hematoxin and eosin staining, in hospital laboratories or in many sort of laboratories, generally H&E staining or hematoxin and eosin staining efficiency and efficacy rely on automated procedures, sort of to accomplish staining on patient specimens. This is crucial. It is crucial for visualizing and investigating tissue architecture, cell and more importantly, the cytology or cellular morphology and abnormalities such as, for example, cell death or necrosis, granulosis, and or inflammation. So this then the different sort of preparation of the specimen on the specimen preparation excuse me, in around the tissue in around as part of the tissue processing procedure is where it allowed to establish whether or not the patient in the patient case in where Hussain sort of iterates on and informs helps establish whether the patient case had been infected with tuberculosis, and additionally where quinine carbonyl fusion staining is utilized to selectively dye the potentially present tuberculosis. A cold staining methodology is utilized in this investigation with quinine carbonyl fusion staining as the primary stain, rather than the sort of traditional Zeil-Nielsen carbonyl fusion stain, which utilizes heat to penetrate which would utilize heat to penetrate tuberculosis sort of cell walls. So that draws this audio podcast to a close. This audio podcast, as part of the Haemotoxy, and Bostics and Baraga and the specials. This audio podcast as part of the Express and Calibre, and this audio podcast as part of a Storm Robotics production.